Prometric QA and Rationales 1 to 75. Question 1. A nurse is caring for a client with dysphagia. Most likely, the client has experienced damage to the frontal lobe, parietal lobe, occipital lobe, temporal lobe. The answer is D. The portion of the cerebrum that controls speech is the temporal lobe. Injury to the frontal lobe causes personality changes, difficulty speaking, and disturbances in memory, reasoning, and concentration. Injury to the parietal lobe causes sensory alterations and problems with spatial relationships. Damage to the occipital lobe causes vision disturbances. Question 2. A client is prescribed diltiazem, cardizem, to manage his hypertension. The nurse should tell the client the diltiazem will lower his blood pressure only, lower his heart rate and blood pressure, lower his blood pressure and increase his urine output, lower his heart rate and blood pressure and increase his urine output. The answer is B. Diltiazem, a calcium channel blocker, will reduce both the heart rate and blood pressure. It doesn't directly affect urine output. Question 3. A client reports substernal chest pain. Test results show electrocardiographic changes and an elevated cardiac troponin level. What should be the focus of nursing care? Improving myocardial oxygenation and reducing cardiac workload. Confirming a suspected diagnosis and preventing complications. Reducing anxiety and relieving pain. Eliminating stressors and providing a non-demanding environment. The answer is A. The client is exhibiting clinical signs and symptoms of a myocardial infarction, MI. Therefore, nursing care should focus on improving myocardial oxygenation and reducing cardiac workload. Confirming the diagnosis of MI and preventing complications, reducing anxiety and relieving pain, and providing a non-demanding environment are secondary to improving myocardial oxygenation and reducing workload. Stressors can't be eliminated, only reduced. Question 4. A client with a myocardial infarction and cardiogenic shock is placed on an intra-aortic balloon pump, IAPB. If the device is functioning properly, the balloon inflates when the tricuspid valve is closed. Pulmonic valve is open. Aortic valve is closed. Mitral valve is closed. The answer is C. An IAPB inflates during diastole when the tricuspid and mitral valves are open and the aortic and pulmonic valves are closed. Question 5. A client with unstable angina receives routine applications of nitroglycerin ointment. The nurse should delay the next dose if the client has atrial fibrillation, a systolic blood pressure below 90 mm of mercury, a headache, skin redness at the current site. The answer is B. Nitroglycerin is a vasodilator and can lower arterial blood pressure. As a rule, when the client's systolic blood pressure is below 90 mm of mercury, the nurse should delay the dose and notify the physician. Nitroglycerin isn't contraindicated in a client with atrial fibrillation. Headache, a common occurrence with nitroglycerin, isn't a cause for withholding a dose. Application sites should be changed with each dose, especially if skin irritation occurs. Question 6. A 43-year-old Arabic male is admitted with sickle cell anemia. The nurse plans to assess circulation in the lower extremities every 2 hours. Which of the following outcome criteria would the nurse use? A. Body temperature of 99 degrees Fahrenheit or less. B. Toes moved in active range of motion. C. Sensation reported when soles of feet are touched. D. Capillary refill of less than 3 seconds. Answer D is correct. It is important to assess the extremities for blood vessel occlusion in a client with sickle cell anemia because a change in capillary refill would indicate a change in circulation. Body temperature, motion, and sensation would not give information regarding peripheral circulation, therefore, answers A, B, and C are incorrect. Question 7. A 30-year-old male from Jordan is brought to the emergency department in sickle cell crisis. What is the best position for this client? A. Side lying with knees flexed. B. Knee chest. C. High fowlers with knees flexed. D. Semi-fowlers with legs extended on the bed. Answer D is correct. Placing the client in semi-fowlers position provides the best oxygenation for this client. Flexion of the hips and knees, which includes the knee-chest position, impedes circulation and is not correct positioning for this client. Therefore, answers A, B, and C are incorrect. Question 8. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? A. Taking hourly blood pressures with mechanical cuff. B. Encouraging fluid intake of at least 200 milliliters per hour. C. Position in high fowlers with knee gauge raised. D. Administering Tylenol as ordered. Answer B is correct. It is important to keep the client in sickle cell crisis hydrated to prevent further sickling of the blood. Answer A is incorrect, because a mechanical cuff places too much pressure on the arm. Answer C is incorrect, because raising the knee gauge impedes circulation. Answer D is incorrect, because Tylenol is too mild and analgesic for the client in crisis. Question 9. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? A. Steak. B. Cottage cheese. C. Popsicle. D. Lima beans. Answer C is correct. Hydration is important in the client with sickle cell disease to prevent thrombus formation. Popsicles, gelatin, juice, and pudding have high fluid content. The foods in answers A, B, and D do not aid in hydration and are, therefore, incorrect. Question 10. A newly admitted client has sickle cell crisis. He is complaining of pain in his feet and hands. The nurse's assessment findings include a pulse oximetry of 92. Assuming that all the following interventions are ordered, which should be done first? A. Adjust the room temperature. B. Give a bolus of 4 fluids. C. Start O2. D. Administer meperidine, Demerol, 75 mg for push. Answer C is correct. The pulse oximetry indicates that oxygen levels are low, thus, oxygenation takes precedence over pain relief. Answer A is incorrect, because although a warm environment reduces pain and minimizes sickling, it would not be a priority. Answer B is incorrect, because although hydration is important, it would not require a bolus. Answer D is incorrect, because Demerol is acidifying to the blood and increases sickling.